Hello, everyone. Welcome to our webinar today. And yeah, let's get started. So I would like to introduce myself. My name is Adriana Meinert, and I'm a psychologist and also a coordinator at the Gynem Fertility Clinic in Prague. And yeah, I'm also in a therapeutic course which concentrates on cognitive behavior therapy. So I'm also a therapist. Next slide. So if you would like to know anything more about me, you can type gynem.com and find the psychology counseling and support on our webpage, because we offer this to our patients during the fertility treatment. Let's have a look what we are gonna go through today. So definitely the psychological part of how does the waiting period for a pregnancy test affect your mental state. Also how to deal with difficult thoughts and general all the emotions and emotional well-being during this period. We will also have a look what should be avoided after embryo transfer, just a short list and also some psychological points. And I guess the most funny and important part is how to view these 14 days differently than just as a passive waiting period time. And last but not least, we will have a look on the recommended activities for like grounding, relaxation during this waiting period time. So let's start it. How does waiting for a pregnancy test affect your mental state? You can take maybe a paper if you're exactly now at this stage and write something down, make some notes. So feel free at the end also to ask me any questions. Let's start with general key principles that are important to know about mental state, mental health. And this is important mainly if you're explaining your partner, your friends, or anyone else how you feel. And or some other friends, they also went through fertility treatment, and they seem like don't really knowing what's happening or knowing what you feel. The emotions are different. So this is normal, because everyone experiences infertility treatment very much differently, and that's okay. Yeah, so if there's a contrast between emotions of yourself and your partner, that's normal. It's just good to talk about it and to accept it, that everyone can experience it differently in a different matter. But everyone has emotions, though they might not be visible during this time. So even if you have the feeling, oh, my partner doesn't really seem to be bothered by this treatment, so just take some time, ask, and maybe you will see their emotions, they are just a little bit hidden or not visible. Generally speaking, fertility treatment, when it's long, for especially, is a response to significant stress situations. So it's quite important how level of resilience and basal trust in the world you have, because if it's, for example, lower resilience, and in general for you it's hard to deal with hard situations in life, it can be hard for you to deal with infertility too. So just also accept that everyone has a different level of this. But what is very common for everyone has needs, and they need to sleep, they need to eat some food, they need some self-care. So if there is a lot of differences between your partner and yourself, definitely the same things are the needs where you can hold each other together. Also, I skipped in the point 4. There is a different amount of time that someone needs to move forward, to move to the next step in the fertility treatment. So if somebody still doesn't want to go to the clinic and just still wants to try at home, it's fine. Yeah, the second partner can be already a step further and would like to get to the clinic, have a consultation, move forward. So there can be conflict between the partners. So again, about it. Okay, so one partner would like to maybe move already forward. Why? The one doesn't want to move forward. Again, why? Try to explain. Try to find a compromise. Maybe try to find a period. Okay, let's try for another 3 months, and then we'll make just an initial consultation without like any like must next steps with the clinic, just an informal consultation. Also, everyone needs to be kind to themselves, and this is especially important in partnership. So if you don't really know what to do, how to help your partner, to be kind and to be generous to the partner is always a good choice. And also, this is not really known, but everyone is usually afraid to ask for help because we are trained to be independent, we are trained to be strong, and to ask for help, it looks like being weak or being not strong enough. But here, really do not hesitate to seek for any help because it is a stress situation or stressful situation. And the support, you might need it, and so just ask for it. And if you don't really have anyone near you that you feel like good with him, you can try to ask some specialists. There are a lot of psychologists also concentrating on fertility journeys, so try to ask for help there. There are many impacts on various areas of life with the fertility or infertility treatment. I will start with the families and friends, because many couples they don't really would like to let know the family that they are going through fertility treatment, so they just hide it or they keep it for themselves, which can strengthen the couple feeling or the partnership, but the couple itself can be weaker because they like lose the support system in the family and in friends. So talk about it with your partner. How do you feel? Do you want to keep it only for yourself, or do you want to share it with your friends, maybe with someone also going through this treatment? Another area which is affected by fertility treatment is definitely the finance area, because fertility treatment is usually not totally covered by the insurance, usually just partly covered by the insurance. So it's definitely costly for the couple. Again, it affects the career perspective, because on the other hand, the boss can be very kind, but the boss can be very angry about you if you need to leave for ultrasounds, if you need to leave for a longer time. So it depends on the atmosphere in your company. And also it blocks a little bit women in moving forward in the, let's say, development of their career, because there can be some thoughts about, oh, should I take the higher job, the better position, or should I not take it because it's connected with loads of stress, and higher amount of my resilience would be needed for my job and not really for my fertility treatment. So there are many questions around job and career perspective. Of course, many questions, and let's say the impact is also on the partnership, because fertility treatment, especially if it's taking longer time than 1 year, it's seen as a quite stressful situation. So the partnership can be, it's like a challenge for the partnership, how good you can communicate with your partner, how much do you know where to find your resources, like partnership resources, and it's quite a challenge. So this is definitely one area. And also a very important area is the self-worth and self-confidence. which means like the fulfillment of the role of the woman, fulfillment of the role of the man about their fertility and reproductivity. This is a big thing, like in yourself, and it's not often communicated outside, but like in you, it's possible that you ask this question. And I did totally up. I have also the developmental stage, because if you have a look on it from the perspective from some psychological theory, like from the Erik Erikson's developmental stages theory, it's a psychosocial theory which has some stages in your life, and every developmental stage has some, let's say, conflict in it. So this conflict is like between generativity and stagnancy. And if the fertility is not successful for a longer time, it might be seen like a stagnation in your life, that it's not fulfilled. There's a feeling of there's no purpose in my life, something is missing, because there is this stagnation in my life. So I mean, of course it might feel like this, but I think it's important to see it also from a different perspective, and see like your everyday challenges and your everyday efforts that you do to like move forward, and maybe in your life, and maybe also see like different areas in your life where you can move forward, not only the fertility treatment. Because then you can see, well, I'm maybe not that passive, not that stagnating in my life, and I'm moving forward, and I'm like generativity there is there, but in other areas in my life. And this gives you a better feeling of how you fulfill this this developmental stage. So try to see, for example, your job or your partnership is moving forward, or you can travel, you can meet friends. All these areas are not passive. You can keep them active, so you feel there is not that much stagnation as you maybe feel with the fertility treatment. Okay, we'll also have a look on what emotions do you encounter during infertility treatment. And we will also get then to the thoughts, to the intrusive thoughts I will explain later. So first, the emotions. Maybe if you have some time, and you can pause it now once it's recorded, and write down which emotions do you actually feel and encounter during fertility treatment, and write a list, and we will see if you get that many as I have here. So there's fear, there's anxiety, there can be some panic attacks before the transfer, before the egg retrieval, if there's a very hard situation for you, especially in the waiting period time for the pregnancy test. There can be a lot of sadness, a lot of actually like kind of depression feelings, or starting the depression episodes. There can be a lot of anger on at the others, that they don't understand, you don't want to explain it, they don't understand your feelings or the situation, or your job boss is very angry with you. You can be angry on yourself, that maybe you have the thoughts, I'm not doing enough, I should do more. So there can be a lot of anger too at yourself. There can be envy, which is if you see any other women who is pregnant, or any other babies. The envy is kind of emotion which many people try to hide, because there's a lot of shame for this emotion. But again, it's a totally normal emotion. If someone has something you don't have, and you really strive for it, and it's not happening, of course there is the envy emotion. So again, please do not be ashamed for this. That's pretty normal. Many women feel it. Again, despair, emotional pain, shame, everything can be there. And I just want to let you know that it's normal and it's common to encounter those emotions during infertility treatment, and also that they are temporary. It means that if you feel it at once and you're very full of those emotions, okay, write them down, just be there with those emotions, take some time to let the emotion just be, and then it will go down, like the level of the emotion or the feeling that you are out of control of those emotions, it will get better with some time. So keep the breathing or keep writing it down, and also saying this emotion can come and I don't need to stop the emotion, or I don't need to forbid myself this emotion. It's important just to see it there, write it down, accept it, and then it can maybe be a little bit better, bearable. Okay. We'll have a look now on the intrusive thoughts that affect your emotional well-being, because from the cognitive behavioral perspective, or general from a psychological perspective, the thoughts are the first that comes, then the emotions. So if you feel sad, if you feel envy, if you feel ashamed, there might be a reason why. So just keep asking yourself why is that? And then it's possible that you get to those important thoughts that might get you to the answer. Why do I feel so? Okay, can I do something about it? And again, you just don't hide from those emotions. You don't run away from these thoughts and emotions. You just stay there, yeah, with some acceptance and with some interest actually for yourself. Why do I feel so? Can I explain it to myself? Can I search for this? And that's the first step actually. If you accept it, that it's there, the emotion, the thought, it's there. Let's just have a look with some interested view on it. Let's have a look on the emotion. There will also be some example which we will go through, but first I would like to tell you how to talk about any intrusive thoughts, and then about those emotions with yourself and with others, because as I told, there can be a lot of shame because of these emotions, so please do not be ashamed. Okay, it can happen, it's normal. If there's a stressful, hard situation, of course, there are emotions. We're emotional people. We have amygdala, we have limbic system, everything that produce our emotions. So you can't really stop emotions. That's a thing. But you can change the perspective how you look at emotions, as maybe as a signal that gives you if that you like something, that you don't like something, that you maybe would like to do something with the situation. So it's actually kind of interesting impulse and information, such an emotion. And again, many women, men, couples, they all experience those emotions during the treatment. At some people, it's more visible. Some people are not that much, but they all feel it. So you can allow it to yourself with acceptance. And again, you can even it's hard. I know it's a lot of work and a lot of introspective work, but there is the choice that you can let your emotions drive you, or you can drive on your emotions. And that's how I was already talking about. Be interested, be cautious about your emotions and curious about the emotions. Okay, why do I feel that? Let's search for them. So, or let's search for the reason and for the thoughts. So write them down and try to understand them a little bit. Once you've done this, once you've already written it down, you understand a little bit more why there are a lot of emotions, then you can share it with your loved ones, and that can energize you a little bit. Yeah, I always say, please do choose those that or people that who do not belittle your thoughts and feelings. So people who give you a secure space, safe space, where you feel very beloved. And then you can share those emotions with them, because I know it's a very sensitive topic. It's not possible to talk about it on a meeting with your boss. Maybe it is. Maybe the boss is very kind, but usually not. So trying to find a really safe space with some nice people around you. And you can start just, I don't feel great, this makes me sad, and I just want to talk about it a little bit. You have some time, can we talk like 15 minutes about my topic, because it's so hard for me. So even this small sharing can help you to bear the emotions a little bit more, and again to allow actually to feel those emotions. You can give them those 15 minutes at least. And even if they overwhelm you, because you can say, oh, it's just 15 minutes, then we will do something else. There is the deadline, let's say, for the emotions, and that's also good for you. Yeah, better than to start getting to the emotions at 10 p.m. and then don't having any deadline. It can be hard to stop it. But we'll talk about that later too. This is some examples for the other side. So, for example, for your partner, for your kind boss, for your friends, how to listen and how to respond to if you share such emotions and thoughts. Definitely with empathy and gentleness, because this topic is very sensitive for the women or men. So do not push. I always say, do not ask facts, just ask for the emotions. So if there's a question, oh, okay, and how many IVF rounds did you had? How many eggs have been retrieved? Those are questions for facts. And this is not really helpful. It's just, I know this other side is curious and they would like to know some more, but you can also answer like, I don't want to tell you those things. Me, I just would like to share my thoughts and my emotions. This is what helps me, and this is how you can help me to bear it better. And then you can give the other side those instructions, how they would like to share it, or please give me just a hug. That's the best support you can give me. I don't want to talk in detail about that. And then the other side can react with some empathy. Okay, if you do want to talk about it. If not, it's okay. And all those examples I have there. So what can I do for you? Can I give you a hug? Maybe that's the best what I can do for you now. Why not? I mean, a hug is very nice, and it can support the other side, and it gives it a signal that you take care about the other person who is in emotions. Okay, we'll do a little break from all the emotions and thoughts. We will get to them later. And we will now have a look on that topic that many women, many patients, many partners are asking, what to avoid after embryo transfer. So let's have a look. There are some medical things, but there are also some psychological things. The medical things you will maybe, or of course, receive from your doctors, from your fertility specialists. And it's usually those first four: avoid hot baths, about like being with your butt in the water, so no saunas, no swimming pools, because there are infection risks. It's better to just have a shower and that's it. Do not lift heavy objects. That means like 10 kilos or more, because you will need to put together all your belly muscles, and it should be more relaxed. So all the groceries or luggages, please ask your partners to carry them. Avoid jumping or running, because I mean, stairs are fine. You can normally walk, but you don't need to run crazy as a Phoebe around. You just walk smoothly, and that's it. Please also do limit cardio exercise, because they exhaust the body, and the body needs the energy now to concentrate on different things, on the implantation of the embryo, and not on any diet or any special schedule in your cardio exercise. Do skip it for now. From the psychological point of view, relaxing exercises are perfect, because it's like the body to mind intervention. If you do something relaxing to your body, the mind will be relaxed too. I'm talking about walking, I'm talking about pregnancy yoga, I'm talking about just sitting and meditating, or even sitting and not meditating. It's fine if you just sit for 5 minutes. You let be your thoughts without any judging. It's kind of a little bit of mindfulness training, and you just be. And even that is quite a big relaxation technique in our lives, which are usually concentrating on some goals or on some deadlines. So just 5 minutes of sitting is a lot of relaxation, actually. Sex is actually possible. Usually recommended at least like 5 days post-transfer, also because of infection risk. So if you feel up to it, feel free. It's relaxing, of course. If you feel afraid about it, just let it be. It's totally the women's decision. I always say this. Be also cautious about a balanced diet. I mean more like eating familiar food to avoid any allergies, because we don't want the body to have any shocks. So just stick to that, About the thoughts, I've been talking about it, and we will do an exercise too. So it's better to actively work with the thoughts and allow yourself the thoughts than just to run away from them or deny them. So it's better to accept that it's okay to ask yourself, what about it's not going to happen? What about it's going to happen? All those thoughts are normal in the situation. If you had anytime had any like a job interview or any stressful situation where the outcome is yes or no, maybe you also had all those thoughts. What about if they hire me? What about if they don't hire me? Those are normal thoughts before such a situation. So again, in this situation with the pregnancy test, it's normal to have these thoughts, and better to allow them for some time and then to distract yourself with other activities. The other activities, it can be relaxing activities, and we will have a look also later on some examples of relaxing and grounding activities here. Just for example, maybe from your like needs, drink warm tea, read a book, do some guided relaxation, sit for 5 minutes. This is everything very nice for your mind too. Good. Now, I guess this is the most important topic now from your side, and because before the embryo transfer, let's have a small stop here and just think about the situation. You're after the embryo transfer, and like before it was all about searching for appointments. It was all about sticking to the strict plan with the medication. Planning all the journey, planning all the flight tickets, or maybe just train tickets if you need to get to another city to have the ultrasound scan. And all this planning has already been. You've been to the transfer, maybe to a nice situation, or maybe a stressful situation as a transfer. And now what? Now you're there, now you're at home. And what should you do now? And I know we're all taught about we need to do something, we need to be very active, but this situation, like waiting for actually anything, but here for the pregnancy test, makes us feel that I'm not doing anything. I feel very passive. I can't do anything because the embryo needs to do it. So it's hard to stay calm, and of course everyone tells you, yeah, just stay calm and that's it. But how am I supposed to do that in such an important moment in my life? So yeah, let's have a look on it. It's good to start with some realistic and conscious support, really from scratch. So even that the child is wanted, that's a good start, because there have been, or there are still women where the child is not wanted. And if the child then is developing, is born, the child feels it. There has been a couple of scientific studies on that. So even if you really want a child, this is already very much helping. Even though it doesn't sound as doing anything, it is. Okay? Second point is using the modern technologies. I assume you can be on a fertility clinic, working with embryologists, working with laboratories in there, and they're all doing their best job, what they can. So selecting a quality embryo for transfer, helping a little bit where to put it in the uterus. So this is very much useful in your situation. So again, consciously let you know that, yes, this is also helping me. Ask for a support from your loving partner and loving friends if you want. This is also very much helping if there is someone at your side sharing your anxiety with you about the situation. And if there is not a blockage, but it's hard for the partner to verbally talk about it, just ask for some long hug. Just ask for some very nice massage, because hugs or touching your partner, it straighten the fate in the relationship and the fate that we will make it together. We are in it together. So that's very helpful too. Also, try to support yourself, and that means again some thoughtful work with your thoughts, and remind yourself that what you've done already for the treatment, all the preparation, all the concentration, this has been so much work already. So try to write a list for yourself. What do you have already done, and what do you have already achieved in this treatment? This might reduce a lot of stress, because you will see the whole list and you will see, wow, I've done so much already. And that's the point, okay? To seeing that you're doing still so much, you have done already so much, and it's not like doing anything and feeling like being passive. It's exactly the opposite. You're very active in this. For example, you're active because you're here at this webinar, so thank yourself for that. Those are some examples of active relaxation. We are not going to go through this here, because there are many wonderful videos at YouTube that you can search for. Search for the one with the nice voice where you feel very safe and very kind, being kind to yourself. So you like the voice and you like the small training. It's very good actually, because the progressive muscle relaxation from Jacobsen, it's like releasing tension in your body. And for the embryo transfer, the pelvic floor, in some muscles, they need to be quite tense, quite fit, quite strong, but some muscles should be relaxed, should be feeling smooth, warm. So that's how you can keep working on it, doing progressive muscle relaxation, which relieves muscle tension especially from those muscles you can't influence with your will. So all the spine muscles, all the pelvic muscles, this is very helpful. And again, it's a body to mind intervention, so your mind will be feeling very nice too. Here are some other examples what you can do to relax. Time outside, like outdoors, helps a lot. The contact with nature is very wonderful for your mental state. First, the green color let's say the brain loves the green color, so it's automatically relaxing you. And second, in the nature, the time is running slower. You can see, I mean, a tree is not growing in one day, so it's easier for you to slow down because the nature also slows down. So that's why time being outdoor helps a lot. You can do some breath techniques. Usually the one I've here, 3 and 6, it means if you breathing in, you count on 3, and if you breathe out, you count to 6. So you're doubling the breathing out phase, and it's making you feeling that the pulse is going down. You're relaxed, very very fastly, actually. So again, it's a body-to-mind intervention helping you, for example, before the embryo transfer or in a situation that is suddenly very stressful for you. Just do this breathing. It's helping a lot. I've already mentioned the progressive muscle relaxation. You can also search for some exercises for pelvic floor, which makes like the pelvic floor trained, but also relaxed at once. And if you might experience some problems in falling asleep or like having a good sleep, you can try the body scan. You can search for an audio on YouTube too, because with the body scan, you go through with breathing small parts of your body, and it makes you feel sleepy, it makes you feel relaxed, and it's easy to fall asleep. So this is very, very nice relaxation technique too. So we will now start with some exercises about heart thoughts, intrusive thoughts. Intrusive thought means they come a lot, many times, the same thoughts again. For example, it will not happen. I'm not going to be pregnant. And this is actually a negative intrusive thought that impacts you a lot. The emotional state after this thought is maybe sadness, anger on the whole world, how it's not fair, and so on. So the emotional state after those emotions is not the best, and there is a choice to change like the perspective to this thought. Okay, I will guide you through training after this. The first thing what you can do is set an alarm for like 30 minutes and not to block or deny these thoughts, just write them down. And you can start to write them down for those 30 minutes and you will see after 20 minutes, I really don't have anything more to write. So then I'll just plan an activity after that so you can think about other stuff. But with those 30 minutes, you let yourself know, I'm not denying the thoughts, I'm accepting them, they're there. And maybe after a few days of writing those thoughts, it will be less affecting you and your emotional state, because you will see that they are not that strong, the thoughts, as they feel at the first view. And we will try also to find alternative thought to the first one. Yeah, so I have here an example. For example, after the embryo transfer, you might feel like a small twitch in your body, which hurts a little bit, but then it goes away. And of course, the thoughts are suddenly starting to be like in a circle. And it can be that suddenly twitched, maybe I was walking too quickly, or I hope I didn't hurt the embryo. Maybe I should be lying down. Maybe I should not have that much stress. How can I have less stress? And the thoughts are starting to be faster and faster. So it's better to do some kind of relaxation now, breathe a little bit, do any audio relaxation technique, and think about the thought. Is this thought really true that you walk too quickly and that you hurt the embryo? I mean, it's not really possible to hurt the embryo from outside. So maybe you will find alternative thought. For example, it doesn't matter that it twitched. The little embryo is strong enough and can endure, can make it. Walking fast like is actually good for blood circulation in your body. But okay, maybe I walked too fast, so now I can slow down a little bit. But I'm actually glad that I took a walk, because just lying down at home, it makes me feel crazy, let's say, yeah? So actually it's better to go for a walk than not to walk at all. But what I want to say with this, it's the, like having a look on the thoughts that makes you feel bad, and the thoughts are coming again and again and again. So we will have a look on such a training. If you have a paper at home, I assume you have, so please take a pen or write it down into your phone, and you can write this down always if you have the like feeling I still have this 1 or 2 thoughts and they're not going away. For example, it's not going to work. And we will have a look on the thought. Is it true or not? Let's search for some argumentation. So this is how it looks like. It's a cognitive behavioral technique. And there is the situation, you sit at home 5 days after the embryo transfer, and there is some feeling of a twinge in lower abdomen that hurts a little bit, but goes away very quickly. And the first emotions after that can be, there's a surprise, such a twinge, why? There's a fear, there's maybe anxiety, I don't know what to do about it. That's all it told. Yeah, do you see the difference? So there's surprise, fear, anxiety, sadness, for example, helplessness, and there are many, many thoughts. Something must be wrong. What if something's happening? What should I do? You can write this down, and it's important to distinguish between emotions and thoughts. And then you choose one thought that feels the strongest one, the burning one, the most hard one thought, and you search the arguments for it. So here we've chosen the thought, something must be wrong, and we are searching arguments for it. Why yes, why not? So why it is true that something is wrong. Maybe when embryo implants, it is not painful, and we search for facts. That's the important in the argumentation. And also another fact, other women have not reported such pain after the embryo transfer. Let's search for some facts and arguments against this thought. There are hormonal changes during pregnancy, and this can cause abdominal pain. Another fact, the pain was brief and hasn't continued. And this is very important because those facts make the thought be actually not that truthful as we thought at the beginning. So the outcome and also an alternative thought would be, I just felt a little twinge, but it doesn't necessarily mean anything. I will continue taking my medications and go for a walk. If the pain worsens, I will consult my doctor. And how do you feel after such an alternative thought? Usually not that much surprise, usually not that much of fear, usually not that much anxiety or sadness. It's more actually about some relief and some hope, about some feeling of activization that, okay, I'm going for a walk and it's gonna be okay. And this is what we actually need to achieve in this period of waiting for the pregnancy test, to find some relief in those alternative thoughts. This training can be done at home, but sometimes it's hard if you do it alone. It's better sometimes to do it with someone else who can give you the second perspective on this thought or on this situation. So at the end, or we are nearly at the end, so I just wanted to discuss with you what is generally recommended in this period, which support and resources to search for. In general, discussion forums are not recommended because they are spreading very many misinformation and they are very exhausting. I've heard about some patients or women, they have searched for like 6 hours on discussion forums, and afterwards there was a huge exhaustion, a huge anxiety, and this is actually not what we want. So if there are some medical questions, of course, some of them are maybe important, some of them not, so just try to consult it with your doctor later in a consultation. But don't search for them at such forums, because there are a lot of misinformation, and usually it's not like set for you individually. It's some general information for some other women with some other anamnesis, totally different situation. What you can search for are some expert articles. That means like some scientific papers from fertility clinics, gynecologists, psychologists, You can try to search for therapy through sharing, because I am aware of some groups of women, usually in countries they gather around egg donation, they gather around IVF treatment or reimplantation analysis, and then IVF treatment. So you can try to search for that. There are many podcasts, many journals. You can try to have your own journal about your fertility treatment, because it can help you to share with yourself your thoughts, and not, again, to deny them, but to accept them and allow them. And if you don't know anymore and you're struggling a lot during this time, not only after the pregnancy test, but in general during your fertility treatment, please do search for some help. Search for some expertise or psychological counseling, so psychotherapy, any experts in this matter. Because let's say the scientific papers now, they show that women who experience and receive specialized social and therapeutic support during infertility, they experience less stress than women who do not receive any of such support. And this is seen everywhere in this paper. So such a let's say, expertise and help in psychology or social and therapeutic support, it's very important, and it's helping a lot during this period. So in conclusion, I would like to congratulate you that you've been here and on today's participation on this first active step in caring for your well-being and for your mental state in such a hard situation. And fingers crossed very much for your treatment. And thank you very much for the attention today. Thank you for the whole attention on this webinar. And now we will be going further to the discussion part.